Hello everyone, and thanks for joining us today for this webinar on humanitarian action in the Sahel during COVID-19. I am Flore Berger, a research analyst at the IISS in charge of monitoring conflicts across the Sahel, but especially in Mali, Niger, and Burkina Faso. Today I'm very happy to chair this discussion, and I'm joined from two humanitarians joining us from Bamako and Ouagadougou. So to speak today, we have Jean-Nicolas Marti, the head of the ICRC delegation in Mali, and Jackie MacLeod, who is the Burkina Faso country director for the IRC. Thanks to both of you for taking the time to join us today and participate in this conversation. So we'll have about an hour for this webinar, and we'll start with half an hour of discussion, and then we'll have about 30 minutes to take questions from the audience. So to do so, please use the Zoom Q&A feature to ask any questions you'd like. You can send them while we have the discussion or afterwards at any time will work. And I'll take them as they come, and we'll do our best to address as many as possible within the time allowed. And yes, I won't take more time for the introduction, so let's crack on with the discussion. So I'd like first to ask both speakers to give us a snapshot of the humanitarian situation in Mali and Burkina Faso, because I think it's important to remember that there is a reality that exists before the crisis. Despite COVID-19 getting all the attention these days. So let's start with you, Jackie. Can you tell us a bit about the humanitarian situation in Burkina Faso?
Sure, thanks, Fleur. So just to give a separate from, and in addition to the COVID-19 crisis, the humanitarian situation here in Burkina Faso, in brief, is that we currently have over 850,000 IDPs displaced within the country. There is a proportion of refugees also mostly coming from Mali, which are displaced mostly in the north of the country. This is due to ongoing violence, so it's mostly religious violence. So let's say, non-state armed actors, but also exacerbated by some auto defense groups and various levels of different fighting which have been occurring and escalating for the last 13 months or so, maybe even longer, actually at this point, closer to 14 months. So this is fairly new to the context of Burkina Faso. It's been a relatively stable country within the Sahel region for decades. But really this violence escalated in the last 12 months. By April of 2019, there were around 120,000 people who were displaced, and at current, as I mentioned before, it's now about 850,000 people, and that number grows monthly. So this is the latest information that we have from UN OCHA. We can assume that that number is higher at this point. So the highest numbers of displaced are in the north of the country, so in the areas which border Mali and also border Niger, and that's just where most of this fighting is taking place. The greatest needs, even prior to the health needs brought on or exacerbated by the virus, are related to shelter, water sanitation and hygiene, protection, food security, health access. When the conflict kicked off and really exacerbated, a lot of the health facilities and the doctors and even community health workers who worked in that region have abandoned their posts. And therefore people who either were living currently in that area or previously in those areas or had become displaced to those areas don't have or did not have access to proper health care or any health care for that matter. So that's a very broad overview. Obviously, there's a lot more nuance to it than that, but this type of violence, it's similar to what we see in other parts of the Sahel, although it does have its own kind of unique flavor here in Burkina Faso because of the different groups that are fighting, and also their ability and their use of existing ethnic tensions to sort of ally themselves with different groups that are up in these parts of the country, like I said, particularly sort of ringing around the north, west, and east of the country as well. So
yeah, thank you for that. Well, we see already that there are many challenges outside of COVID. So now turning to you, Jean-Nicolas, can you tell us how it looks like in Mali, which is not much better than Burkina Faso, I'm afraid.
No, thank you. The main difference between Burkina Faso and Mali is that we are, unfortunately for Mali, somehow 10 years ahead with the crisis in terms of conflict between ethnic groups, conflict between armed group and the government, intervention of international forces. I mean, these dynamics have been ongoing here in Mali for almost 9 years now. And we have to understand that this conflict in Mali is now becoming a protracted conflict. We saw it coming back in 2011 to 2012, 2013, and people thought it's gonna decrease after this peak in the time. But to the contrary, in the recent years, we have seen the conflict broadening inside Mali. The center of Mali was not touched at all, but now it is one of the epicenter of the conflict. For example, we as ICRC, we have treated more patients in Marti hospital in the center than we did in Kidal and Gao together last year in 2019. So it means the number of war-wounded people are more in the center of Mali at the moment, and that has an impact and the relationship with what Jackie just said. This conflict dynamics between the groups is far-reaching over the borders, and there is an interaction back and forward between Mali, Burkina Faso, Niger in this so-called Liptako-Gourma triangle region, and this is an issue that will have and already have humanitarian consequences and impact on the ground, because the crisis is not anymore limited to northern Mali. It has widespread, and it is now going much further. It's not anymore Burkina Faso. We all know that Burkina Faso is in big trouble today, but the question now is towards the coastal countries like Ghana, Togo, and Benin might be the next hotspot in the region. So, in a nutshell, in terms of humanitarian needs, we are far in a much more difficult situation today than we were in 2012. In terms of number of IDPs, number of refugees, people detained or war wounded, it is definitely increasing. And we haven't started yet to discuss COVID-19 that we probably speak about in the next phase. But let me just elaborate a little bit more on the intervention of the international community in a context like Mali and the Sahel region. We have seen a multiplication of different actors, being from development, they have been here much before the crisis, humanitarian actors that were progressively coming in, and other international actors being politic or military or security like actors. And this big mainstream of people coming in is difficult to coordinate. It's difficult to see how to work together, but differently in terms of mandate and capacity. And this is an issue. I mean, it's very much talked about so-called nexus, but it is something that is difficult to put on the ground because of the different mandate, different capacity of the different organizations.
Thank you. So yeah, now moving to the topic of this webinar and the impact of this new crisis, COVID-19, on humanitarian action. Jackie, if I can start with you, can you tell us how has the deployment of staff been affected by COVID-19 and how the IRC is deciding to deploy or evacuate staff from affected areas? And of course, how does this then impact the work that you're doing in Burkina Faso?
Yeah, so the answer to that actually, I mean, it varies a little bit depending on the country that we're speaking about, because we make decisions sort of based on the risk categorization of the country, and that is a sort of multivariate analysis that we bring into that. Again, COVID-19 being part of that, but also there are other analyses that we look at when we make decisions about whether or not, or when and whether to intervene, and also at what level we bring in staff. So for IRC here in Burkina Faso, we are up till now still managed by what we call our emergency unit. And so most of the staff, although we're transitioning to management by the West Africa Regional Hub, but we have been here mostly staffed by emergency unit staff like myself. So people who rove from country program to country program and often set up new emergency responses. In situations like this, we will very often stay, even when maybe perhaps there are other risk factors that might preclude that in longer term deployments, and we might pull people out. However, the decision for that is always going to be based on a few things. One, we want to make sure that the people who are staying are not going to, well, to the best of our analysis, are not going to be placing an undue burden on an already fragile health system. So we do know that there are underlying risk factors, for example, related to COVID-19, and some of those factors, the ones that we know, are related to age, existing health status. This becomes very touchy, obviously, because you can't ask people too many questions. We are an American organization and we have pretty strict rules, and I think globally everyone has pretty strict rules about what you can and cannot ask or enforce. But to some extent, evacuation can also be voluntary, and if people don't feel safe to continue working in a country program where a pandemic is present, although that is globally, they are free to leave. One thing that we also consider is that, if you are, for example, delocalized staff, so even speaking about our own national staff who are working in areas of the country that are not Ouagadougou, for example, is it maybe even safer for them to stay in those base locations rather than to come to the hotspot where numbers of the infection have gone up as compared to where they are? So these are different factors that we take into consideration when, making sort of directive orders about who comes in and who stays in and who has to go out. So all of that is to say that in terms of Burkina Faso, which is where I'll try to limit my response to this, we did in the very beginning have a couple of temporary staff here who we decided that they would end their deployments a little bit ahead of time for various reasons, and it was fine. And we've also had people who were not able to get in. We canceled or changed their deployments to be remote. So we're running here with a pretty small crew, but everyone here has made the decision to be here and has been, it is done with a very, as I said, sort of fine-tooth comb to make sure that we are not endangering their lives, but also, very importantly, that we're not putting the lives of our staff at risk. And the final point on that, I think, is important to note is that, it is, again, a balancing act, because pulling out and evacuating entirely and saying, okay, we'll leave this to a crew of national staff to manage because we want to make sure that, we're not bringing in expats unnecessarily, that can also have a knock-on effect of putting the national staff in more risk or placing an undue burden on them, especially in an acute emergency. So Burkina Faso being different than or particular than, for example, Mali, is that because IRC is new here, we don't have well or long established systems. So if we were to pull out all of our expatriate staff, we would be leaving a team here, some of whom were recruited less than 6 months ago. and being able to sort of manage the emergency on their own would not end well or would not result in a very successful intervention for them in many ways. So I think that probably answers the question. And of course, as I said, that answer is going to vary a lot depending on the country program, because different country programs have different risk tolerance, of course, depending on the size of their staff and how well established their teams are.
Yeah, no, I think it's very interesting, especially thinking about the different international and national staff, and how one impacts like the other. So that's very interesting. And now, Jean-Nicolas, if I can turn to you and ask also about the impact, but slightly different question. So how the pandemic so far has impacted your programs and priorities, and let's say in the past 2 months, what did you have to postpone or put on hold, and what did you have to prioritize? And if you have any also interesting point on the staff issue, because I'm sure the ICRC might be impacted by it too, please feel free to share that too.
Yeah, thank you. Maybe just rebound on what Jackie said on the staff and the management, and then go a little bit more on the action of ICRC in Mali in the view of COVID-19. It has been very different from one country to another for the ICRC because different countries have been differently hit by COVID-19. I mean, our staff in China obviously are 6 months ahead of us or something, and for us in Mali, it didn't have that much of an impact. I had a few families that went back home because ICRC Bamako is this family posting, and we had some difficulties to bring new staff in. I mean, the regular rotation of beginning and end of mission is definitely disturbed, and this is something that is seen and experienced worldwide for the ICRC. We're working now on different scenarios of bringing people in or being able to get people out of context, because at a certain point, all what we said in the first part of the discussion on pre-existing problem will continue later on. I mean, whenever the vaccine is found or there is a treatment for COVID-19, the ICRC operation in the Sahel and in Mali in particular will continue, and we will need to have fresh people in and to have new people to reinforce where need be. At the start of this crisis here in Mali, like elsewhere in the delegations of ICRC worldwide, we decided to make a stop and to look into our objectives and program for 2020, to say what is still realistic to do in the next 3 to 6 months and what is not anymore realistic to have, and what can we do in order to respond to the emerging crisis. The first point we had about Mali was the fact that, taking into consideration the status of the health system in Mali, it was unrealistic to think that we will be able to help the authorities, who were as well realistic about it, to treat a large number of COVID-19 severe cases. It is just not physically possible. So we put many efforts on the prevention side and on the fact that we mobilize our networks of interlocutors, being state authorities, being non-state actors, being the National Red Cross, in order to pass on the messages about the so-called gestes barrières, as we say in French, to protect, to wash their hands, to take the distance, physical distance with others. This was definitely our first axis of intervention. The second was to reinforce our intervention in two main areas where we are already active. The detention facilities, I mean the prisons, the detention center, we advocate with the Malian government to get some people released, to decrease a little bit of the pressure on the number of detainees in places of detention. We increase our hygiene promotion and hygiene assistance to these places. And for the time being, we haven't seen that many cases, or it is at least not an issue. So it was important for us that the virus could not find its way through the prison system. And for the time being, it has been okay. The second is the health system. We are present in 3 hospitals in the north, in Kidal, in the center, in Marti, and in Gao. And there we, together with the National Health Authority, we worked on protective measure, potential response, and possibility to separate people who have been touched by the COVID-19. So prison system and health system were our 2 priorities. But at the same time, we wanted to be able to have our business, as we said, our business continuity, our operational continuity to be secured. And we were still able to make distribution of non-food items, food items for people who were displaced by the conflict. We were still able to visit detainees. We were still able to evacuate people when need be. But we had to take measures to protect the people and to protect our staff as well. So safe programming measures were put in place. Distribution could not take place in large number of people as we usually do. It takes longer, it is more complicated, but it's still possible to operate if you take the necessary precautions. So in a nutshell, our life has become more complicated, but we are still able to respond to the level, to the needs we want to respond to.
Yeah, well, it's very reassuring to see that, you know, despite the additional measures and burden, you still manage to, you know, provide and, you know, respond to people's needs, and that they're not just left to themselves. So now moving on to Jackie again. So as we said already multiple times, COVID-19 is happening on top of like an existing humanitarian crisis. And the humanitarian sector is used with dealing with crisis. That's in fact what it does. But what, in your opinion, are the kind of inherent challenges of COVID-19? How are these challenges different from other crises or Ebola, for example? And how is the IRC coping with these new challenges?
Yeah, I mean, there's a couple of levels to that. I mean, one is something that Jean-Nicolas already mentioned, and that is, you know, our normal ways of working have had to adjust. You know, for example, distributions, we can't do mass distributions where everybody is gathered in one place, and you know, you can't do that anymore. That's just one example. Home visits, you know, we've had to adjust. So if you're doing health monitoring in a home, or you're checking you know, for nutrition status, you have to adjust to write entirely new program guidance, which amazingly, you know, some of our fantastic staff at headquarters did in record time, and they continue to update and roll out to the teams in the field so that we could basically, with no pause in programming, just a pause for training, essentially, our staff, to be able to adapt a program level, you know, a COVID level adaptation in order to continue their work. So I think what's, you know, the question of how this is different than Ebola is a good one. In one way, it's because, you know, Ebola, it's obvious. There's no sort of having it without knowing it. And so, you know, when people are sick with that, it's very clear. There was no or very little doubt about that occurring. Here, for example, there's a lot of doubt about whether this is even a real thing. And so getting people to sort of adopt social distancing and regular protective and preventative measures has been a challenge. You know, we can reinforce that, and we do reinforce that amongst our own staff. But it's impossible to know what happens, you know, after and between working hours. So just kind of control of infection is a challenge in this situation, because it is sort of a lurking thing that here we're not really sure if people are taking it very seriously, and there's and this is an assumption, but it's very hard to trust numbers at the moment on reporting of cases. For example, even just testing of cases, and I don't want to get too political on this, so I'll just leave it at that. But it's when we look at some of our neighboring countries and the number of cases that are occurring just over the border, and then we look at the number of cases that are occurring in Burkina Faso, I mean, it seems very odd that people somehow have an immunity to this virus. So that's one thing. And something that I also would like to highlight in particular is what we're calling at IRC the shadow pandemic, and that is protection concerns that are related to COVID-19. This is not particular only to and to a pandemic like COVID-19, but it is something that we're seeing as extremely troubling within this pandemic. And I think a lot of it, or I know this is not my idea, this is kind of coming from my own brain, but it's what we're seeing is that because of the level of social isolation that is required in order to flatten the curve of this virus, that a troubling trend is co-occurring with this virus, which is increase of intimate partner violence, increase of violence against children, people who are having to shelter in place with their abusers are not able to access their normal support systems, and humanitarian organizations who would normally be able to provide assistance or at least even have data and be able to access the survivors of this kind of abuse are not able to do that in the same way that we were. And so this is one of the particular challenges that we are, again, proactively working to overcome. But I mean, one example is just simply even when you look at school closure. So if children primarily who were abused would have contact with teachers being the main sort of people who would recognize signs of abuse and be able to report, and when schools are closed, that main point of contact is not happening. Safe healing and learning spaces that IRC normally sets up, we can and will continue to do them, but again, with the sort of lockdown orders and confinement and restriction, this is obviously an enormous challenge, and it's not particular only to Burkina Faso, but it is something that we're seeing globally with this pandemic. So I believe that there is a way that we can adapt all programming, as we've done with our water, sanitation, and hygiene, and our health programming, and with other programming, in order to be able to serve and address this shadow pandemic, as we're calling it. But this is obviously a massive concern that is something that's I would believe that we're seeing in probably every context, including in Western contexts as well, but very acutely in places where humanitarians are very often the only ones who are providing these types of services for survivors.
Yeah, thank you. It's very, very interesting. So now for the last question, before we move to the Q&A, Jean-Nicolas, I'd like to ask about the long-term impact, because there's a lot of focus on, how the COVID is impacting the situation now, and you've mentioned what you had to do in the past months to adapt to it. But what is going to be the impact in the long term, first on the humanitarian situation in Mali, but also on your work? Like, how is the ICRC going to deal with, this additional burden in the months and, if not years to come?
Well, that's the $1 million question. How do we come out of this crisis? And as we discussed it before, there has been a before the crisis. We are now in the middle of it, but there will be an after COVID-19. Will that after COVID-19 for Mali be in 2 months or 2 years' time? Nobody can tell at the moment. there is definitely one thing that we keep in mind at the ICRC, at least, is that the side effects or the potential global financial economic crisis and social consequences is more likely to hit Mali than the health crisis itself. I mean, the long-term effects, I am much more worried about 2021 or 2022 than I am for now for Mali. I mean, we spoke about this informal economy, this coping mechanism that people have been exerting for years now in the region. This is all playing its role at the moment. On the longer run, nobody knows when the general situation in terms of global economy, in terms of international assistance, international development aid, humanitarian support. This is all big question marks for the future. And a region like the Sahel and especially Mali, which is a lockdown country, depending a lot on the international assistance, is potentially going to face a very difficult time when that international assistance may change in nature or even decrease. As ICRC, we are looking into it. There is a lot of questions that are still unanswered. Will we be able to travel again as we traveled before? Will we be able to bring in and out staff and goods as we were able to do it before? We will be able to continue to have our normal health hospital support program as we had it before. We don't know. We have to be humble and modest to acknowledge the fact that we actually don't know what will the situation look like in a few months from now. But we definitely have to be prepared to see the situation not back to normal, because in Burkina Faso or in Mali or in the Sahel region, it is not a normal situation. But this situation with a non-international armed conflict is still ongoing. And nowadays, the conflict is making more victims than the COVID-19. And in the coming months, we will probably see as well some side effects of this, because all the parties to the conflict do not have the same approach or the same understanding of what the COVID-19 is. I don't want to make too many political statements, but it's clear that the international, the Europeans have another view on the COVID-19 than the armed group in the region. And then on the longer run, this might very well have an impact on the region, on the humanitarian needs, and the way we have to work to respond to these needs.
Yeah, absolutely. Well, I guess we should have another webinar in a few months to look at, how the long-term impact has, like how situation has evolved and the impact on the ICRC's action. So it's been a bit more than half an hour, so we'll now open to questions from the audience. So again, if you want to submit a question, we're using the Zoom's Q&A feature, and you can type your question and we'll answer live. So just before, but to let a bit of time for people to ask questions, I have a question on my own, and it also very much linked to what Jean-Nicolas just said. So I wanted to ask, both of you quickly, or so how is COVID-19 going to disrupt other health responses? And because that's one of my main concerns. So, if response to other diseases are neglected due to the pandemic, and the months or indeed years to come, on HIV, tuberculosis, basically any other tropical disease, what's your opinion on that? And is it also something that you're worried about, or not necessarily? Maybe Jackie, we start with you.
Yeah, sure. I mean, it's something that we're concerned about. I think the main way that it would be that an intervention, or that responses rather, to things like HIV, tuberculosis, malaria particularly for this context, a potential cholera outbreak, especially in, crowded informal settlements and camps. The risk or the risk of a response interruption is mainly what we're kind of seeing right now, which is a lack of ability to get proper PPE, so personal protective equipment for people to be able to respond to even just regular other types of disease outbreaks or diseases that are sort of common in this area, because we want to be able to make sure that health staff can respond, but also to do that while not putting their own lives at risk. One of the issues, and I'm sure that this is occurring in Mali as well, is that because of the border closures officially, while there's some cargo that's getting in, everyone is scrambling for the same type of equipment. Everyone is scrambling for, face shields and masks and gloves and the disposable bodysuits, and there's a stock rupture and prices are going up, and it's very difficult to get the type of equipment in right now. So as soon as another crisis, another type of health crisis could co-occur, our ability, any humanitarian's ability to be able to respond to that safely is severely hampered. And again, we don't want to put people in harm's way in order to have them respond to another health crisis. So that's what I would see as the biggest risk. There is potentially, although we haven't seen this yet, but there is potentially the risk of a bit of donor fatigue, where everyone's given a lot of money for this new pandemic, and then no one really wants to fund a malaria outbreak or a cholera outbreak. That is also a risk, and I think it's a risk worth mentioning, but sort of the more acute response risk, I would say, is being able to keep our staff safe while responding to a co-occurring health crisis.
Yeah. Jean-Nicolas, would you like to add something to that?
No, I think Jackie brought the main things. I mean, as long as the consequences of the COVID-19 here in Mali is still at the level it is today, it doesn't have a huge impact on the other health program. But there is a ceiling at one point, and if the crisis go beyond, then the system will not be able to cope with it. And of course there is a race for masks and shield and whatever, and we are experiencing it as well. Maybe the good thing, je suis un incalculable optimist, but maybe the good thing with that crisis is that some of us and many of health organizations may think differently when it comes to preparedness for the coming crisis or the coming pandemic.
Yeah, thank you. Okay, so let's start with the first question, which is from Paul Melly from Chatham House. So it's about Burkina Faso. So in the Burkina displaced population, what proportion are pastoralists who have moved with their animal flocks, and what proportion are farming families who will not now be at home to cultivate their fields in the new agricultural season from July onwards? Jackie?
That is such a specific question. I appreciate so much the specificity, and I really don't want to give wrong information about who is pastoralist versus agricultural. So what I can just say is I will endeavor to get information about that, because the number is so high right now, and they come from so many different regions that I wouldn't even hazard a guess. I can certainly do some digging into that information, and I can provide a follow-up to this call, but I don't want to give the wrong information on that. So I'm just gonna have to say I'll look into it.
That's fine.
Sorry.
And Jean-Nicolas, I guess that would be for you. So it's from Sean Smith from Civic Center. He's based in Bamako. So he's asking about how well MINUSMA is coordinating its COVID response in Mali with ICRC and other humanitarian actors. And given that the mission is going to have much more fund towards COVID-related activities, is it a concern that MINUSMA will provide more direct humanitarian assistance?
Well, this comes in a response of what I've said about the different many actors acting in Mali already before the COVID-19. We have a very good relationship with MINUSMA at both political and force level. It would be wrong to understand that ICRC coordinates with MINUSMA. That would mean that we are together doing the same things. I mean, MINUSMA has got an international mandate given by the Security Council. We, as ICRC, we consider the MINUSMA as a party to the conflict, which is not the view of many others. So we have to coordinate to a certain extent, but we have to keep the necessary distance as well. When it comes to the COVID-19 specifically, we had already interactions in Kidal, especially because we are very much alone there with the MINUSMA, and in other places, especially when it comes to the movement. I mean, to bring the samples of people being tested on COVID in remote areas. This is the kind of things that we coordinate with the MINUSMA specifically. Now, as you all know, the MINUSMA mandate is to be reviewed now from May to June. Let's see how in New York, via a video conference, they will manage to redraft the mandate of the peacekeeping operation.
Thanks. And now I see we have a few questions that kind of all relate to the same topic. So it's basically about the impact of the pandemic on the conflict dynamics. So has that changed in the past few months? Is there any efforts to cease hostilities due to the COVID-19? And yeah, generally how the security situation and the conflict dynamics have evolved, well, in Burkina Faso for Jackie and Mali for Jean-Nicolas. Jackie, if we start with you.
Sure. I mean, to be honest, it's really hard to determine whether or not that it's a direct effect of COVID-19 on the conflict dynamics. One thing that I can say, I can draw out as a specific example, is that in this country there's a town in the north in a region that's actually called Sahel, so in a Sahel part of Burkina Faso, that hosts the largest number of IDPs currently, and has for pretty much since the kickoff or the escalation of the conflict here. So shortly after COVID-19 became known and cases were widely reported here, a blockade was formed around that city. And that was formed by non-state armed actors, and it was, preventing both the inflow and outflow of food and non-food items, as well as any kind of humanitarian aid. So it seems, if anything, that there's opportunistic violence escalating in relation to the outbreak, but that it's not certainly slowed anyone down in terms of the type of violent incidents, the nature of the violence. Like, no one's MO has changed really. We're still seeing quite a bit of inter-clan, inter-ethnic violence occurring, as well as the different radical armed groups fighting each other. It's just a little bit more of perhaps like territorial grabbing that we're seeing, but to be honest, because the disease is so new, because the virus is so new here, it's really difficult to say whether or not that is just a little bit of opportunism, and knowing that Burkina Faso had the government of Burkina Faso had put in place a rather strict movement order. So, no public transportation, no movement in between regions of the country for a few months during the initial stages of the virus. And so some of the non-state armed actors took advantage of a little bit of even more lawlessness, let's say, but to be determined how much that continues and for how long that goes on.
Yeah. Jean-Nicolas, in Mali, have you noticed any changes yet, or are you expecting any changes?
Yeah. Well, once again, there was already a new dynamic before the emergence of the COVID crisis. There was after the meeting in Pau in France between the G5 Sahel countries, France and other European actors, a clear shift in the strategy of the French and others to intervene more on one specific group, the Islamic State group, on the border between Mali, Burkina Faso and Niger. And this has already been in place when the Secretary General asked for a general ceasefire or a general trêve worldwide. I can just say that this has not a big echo here in Mali. The call for stopping the hostilities haven't been responded to by any of the parties to the conflict, being the international forces, being the armored group or the Malian armored forces. Nobody laid down their arms at the moment. And in the contrary, over the last 3-4 months, we saw an increased level of violence and conflict, especially in the area I mentioned before, in the three borders area. So there will probably be an impact on humanitarian action. We as ICRC, we do have contact with all these actors and for a long time. I mean, okay, there are a few actors that are more recent in the region, but there are other actors that we have been in contact with since the 90s. And so we have a dialogue on humanitarian access, on humanitarian assistance with all these groups. The COVID-19 didn't change that much for the time being, except for the fact that I mentioned before. I mean, not all the parties to the conflict has the same view on what is the COVID and what advantage they can take from it.
Yeah, absolutely. And if I can add something on this line of question, I think it's fair enough that people are interested, you know, by COVID-19 on the conflict dynamics, also because some of the groups have actually called, you know, on their militants to exploit this new crisis to launch more attacks and etc. But you know, in the field it remains the same. Like the groups still have the same objectives, they have the same means, they have the same capabilities, etc. So it's, I think, important for everyone in government and humanitarian sector to remember that, yeah, those groups continue their life kind of independently of the pandemic, and not everything is now related to it. So another question that we have, because we have quite a lot of UK audience being in the ICRC webinar, what can the UK government do to help the humanitarian response to COVID in the Sahel in light of its potential influence in the French-led Sahel coalition? And I would add, maybe to broaden a bit the question, what do you as humanitarian workers expect from European partners in the months to come? Maybe Jackie to start?
I mean, as humanitarian workers, I'm not sure if this is exactly how the question was meant to be addressed, but I mean, in terms of government support, whether it's European or UK, which I guess is no longer European, government response. I mean, really what we're looking for is a commitment from donors to view crisis in the Sahel, and again, with and apart from COVID. So COVID is here, it's with us. We don't know for how long, until we have a vaccine, potentially after. We know that the landscape is probably permanently changed, but that this is the reality that we live in. But to view this crisis as a sort of, you know, ongoing thing that we will need to be funding, and to look at the multi-layered dynamics that exist in this context, and the fact that it's not only going to be, you know, acute crises that need to be funded, but also long-term opportunities, things like looking at job creation, education, governance. You know, these are interventions that will need to be funded and supported alongside of the, you know, acute emergency interventions. And I would say, you know, if there's a request coming to donors or governments rather, which, sorry, as a humanitarian, I view them as donors, which is probably telling of me. But for them to view this as an opportunity to, you know, really walk the walk of this word nexus, right? Which is a buzzword that's sort of been created, but has yet to really come to fruition in what it actually means, which is meant to be looking at, you know, a meeting point of where we have a humanitarian crisis and development, and how these two things can co-occur, and what is the transition, but also, you know, how do we fund these things? How can we, in one country program, can we imagine that you can be funding, that the same donor can be funding governance programming and also drilling boreholes? So that was a very specific example, but that would be my request.
Jean-Nicolas, anything to add on this?
Yeah, maybe I'll concur with what Jackie said, and maybe I'll just broaden a little bit the perspective of not only donors but influencers in the area from a European perspective. And I used to say for the last 3.5 years that I've been in Mali that the European country and the West in general should get away of looking at Mali and Sahel only through the lens of counterterrorism and migration. I shouldn't look at Sahel through counterterrorism, migration, COVID-19. I mean, we should broaden the view. We should have a much larger approach on a region like Sahel, and a longer view. As Jackie mentioned, the buzzword nexus needs to find some concrete perspective, some concrete realization on the ground, and not being a series of hypothetical or theoretical exchanges in seminars. But what do we concretely make on the ground to be sure that we, as ICRC, as a humanitarian organization, we obtain what we call a sustainable humanitarian impact, and not only a short-term intervention.
Yeah, and I think that's one of the big challenges, like even outside of the humanitarian sector, is that Europeans have their own priorities and the donors have their own priorities, and they don't necessarily think of the Sahel and its issues in the long term, but have their own agenda, which then influences the actors on the ground, and as we've seen, doesn't really have a good long-term impact as the situation continues to deteriorate with the years. So the next question is directed at Jean-Nicolas, so it's linked to the work of the ICRC. What do you think are the main challenges in the forensic field of ICRC in the areas affected by the ongoing armed conflicts amid COVID-19? What are the implications in the management of the dead and carrying out the forensic protocols? Quite a specific one also.
Well, I have to say that like Jackie before, I would need to work a bit further this question. So if you agree, I'll be happy to find out some specific on our forensic program and plans for the region, and I'll get back to you, Flor.
That's fine, absolutely. The next one is also about Mali, but Jackie, feel free to chip in if you have any additions. So what is the current state of mediation efforts between the Malian government and the armed groups after the recent announcement by the Malian president? So this relates, for those who are not aware, of the Malian president saying that he would open negotiation with some jihadist groups. not all of them, two specific leaders, leader of JNIM, the main Al-Qaeda coalition, and leader of the National Liberation Front, active in Marti, where we see most violence, as Jean-Nicolas, you said. So Jean-Nicolas, do you have anything on this mediation effort? Is it something that the ICRC looks as positive? And what do you think what kind of impact or what can we foresee in the future on that topic?
Well, thanks. I see that we have only 7 minutes left. So such a question will require 20 minutes to answer. But now, just on this specific one, we are in a very interesting time. Not only because we have the renewal of the MINUSMA mandate, as I said before, and will the MINUSMA still have this role of being in the leadership of trying to implement the Algiers agreement, question one. Two, we had just parliamentary elections and a new parliament set up in Mali, and how will that influence the political scene in Bamako, and how will be the relationship between the Malian authorities and some of the group that they have now opened up a dialogue with. As you rightly mentioned, this is not all the groups. This is just a part of the group. This group, of course, are not part of the Algiers agreement, which is now almost 6 years old. All this is going to come to play. Anything that would have a humanitarian impact, an impact on population, access to health, freedom of movement, reopening of school, whatsoever, will be welcomed by ICRC anyway. Now, the dynamic are very fluid. As I mentioned before, the conflict is having it's experiencing a very high level of violence and interaction. I mean, you've seen that the French and others have pulled in new troops. So all this is going in parallel of the discussion that we're mentioning in the question. So we'll have to see how it develops. But definitely there are a lot of challenges for the Malian population, for the Malian authorities, and for all the actors in Mali.
Yeah, and yeah, I think after, especially at the beginning of this year in the post-summit, we've seen indeed quite a lot of changes and new dynamics in the conflict, especially in Mali. But I would be interested to know, Jackie, do you also see kind of new dynamics since the beginning of the year in Burkina Faso, or is it more or less the same?
Honestly, it's more or less the same. I mean, the groups that Jean-Nicolas mentioned, they exist in some form or another in slightly different iterations here across the border. Some of them almost in identical iterations. You know, we have JNIM, we have basically Islamic State, and like they're largely they've coalesced, some of them, you know, the ones that are more aligned with each other, and then they kind of split and coalesce and split and coalesce. I mean, there hasn't been much of a change though since the beginning of the year, and I don't know to what extent, you know, the politics and the agreement across the border in Mali has any real effect that we've seen here in Burkina Faso, to be quite honest. I mean, that's hard for me to comment on, because just even tracking, you know, the number of violent incidents per day, per week, per region, it's not as though we've seen an escalation or a de-escalation or a significant change in modus operandi. So, yeah.
Yeah, and I think that's also a good point, because we often see and analyze the situation in Burkina Faso just as like a spillover from Mali. And we just like assume that it's exactly the same dynamics and the same actors and all of that. And for sure, like there is some similarities, and the border definitely is important, but Burkina Faso also has its own dynamics and needs to be seen as such. So yeah, so we come more or less to the end of this hour, and Jean-Nicolas, I know that you have to leave for the field after that, so I'll end it here and hope everyone enjoyed this webinar as much as I did. And thank you for everyone to joining us today, listening and asking interesting questions. And of course, thank you to Jackie and Jean-Nicolas for joining us today and taking the time of their busy schedule. I wish you all a good day. Bye-bye.